Hi everyone, today I am giving you information on the topic blindness. This one is the blindness part 5, in which we'll explain you about the diseases which causes blindness in the whole world. So under the disease prevention and control, the World Health Organization has identified 5 major blinding eye conditions for immediate attention to achieve the goals of Vision 2020, which are okay, the World Health Organization has identified the 5 blinding eye conditions which causes blindness in the whole world, and they have to work on it. So first one is the cataract, second one is childhood blindness, third one is trachoma, fourth one is refractive error and low vision, and fifth one is onchocerciasis. Okay, so in this we'll explain you about only cataract as well as childhood blindness. So cataract, the cataract is basically a clouding of lens in the eye that affects the vision. As the person grows in age, the density of the cataract increases, and the vision get lost in the patient's life. Okay, so this one is the pupil, this is the dilating pupil. Okay, so the whitish area which you are seeing here is the cataract. Okay, now what is the role of cataract in the causing blindness? Is the cataract remains the single largest cause of the blindness. Okay, there is an estimated figure of 17.6 million, which is 39% people worldwide who are blind just because of the curable cataract. Okay, so it is a curable blindness. We have to remove the natural lens which gets cloudy here and have to introduce the new lens which is the intraocular lens at the place of that lens, so the vision which get lost due to the cataract get restored here. Okay, that is why it is a curable blindness. Now the aim and strategy. The aim under the Vision 2020 is to estimate the avoidable blindness due to cataract extraction with intraocular lens transplantation. They have to extract the cataractous lens and have to transplant the new intraocular lens. Okay, to uh, prevent the blindness which was due to the cataract. Strategy is to achieve the aim to measure the increase in the cataract surgery rate. They have to increase the cataract surgery rate per year or per the different years. Okay, have to do more and more surgeries, have to remove more and more cataracts. So it was the main aim and the main strategy. Emphasizes is to be placed on achieving. First one is the high success rate in term of restored vision and the quality of life outcome. Okay, they have to get the success more rates to restore the vision, as well as they have to give the quality of life to the people. Okay, by restoring the vision due to the loss of due to the cataractus disease. Affordable and the accessible services provided to the patients, major to out major to overcome barriers and increase use of services. Okay, they have to take proper measures to overcome these barriers. Okay, they have to do more and more camping or the screenings, so that those people will come under the consideration who have the developed cataract. Okay, and they will implement this thing on those people. They have to find out those people from a particular area and then do the cataract surgeries on them. Next one is the childhood blindness. Childhood blindness is considered a priority area due to the number of years of blindness. Okay, it is also considered as a priority because since the number of years, the childhood blindness is again the main cause of the blindness. So its prevalence is there are 1.4 million blind children estimated in the world, of whom 1 million live in Asia. Okay, only there are 1.4 million blind children are estimated all over the world, out of which 1 million are living only in the Asia, and 3 lakhs of the blind people are in Africa. 5 lakh of the children are going to be blind each year. Okay, so if we are considering that one person or the one child get blind per minute according to this estimation. So again, it is very important to take proper steps so that we should prevent the childhood blindness. Causes. Now what are the causes? Causes vary from place to place and change over the time. The main cause includes, first one is the vitamin A deficiency. The vitamin A deficiency, we all know that it causes the night blindness to the people. Next one is measles. So the measles is a kind of allergic reaction. Okay, this one is the measles. It is a kind of allergic reaction which takes place all over the whole body, and then it affects the eyes also. Next one is conjunctivitis. Conjunctivitis is basically inflammation of the conjunctiva in the eyes. When it takes place since a long time, then it becomes a cause of blindness. Next one, ophthalmia neonatorum. This one is the ophthalmia neonatorum. It takes place in the newborn child. Okay, so the infection is there, and it is very important to treat this infection, otherwise it will cause the blindness to the child. Next one is congenital cataract. Congenital cataract is basically a type of cataract which takes place at the time of the birth of the child. Next one is retinopathy of the prematurity. As the premature birth takes place, then the retina of an eye gets premature at that time, so that condition is known as retinopathy of the prematurity. Okay, so again, these all conditions are very important which cause the blindness to the children, and they come under the childhood blindness. Next one, what are the aim and strategies come under the childhood blindness? Aim is to estimate avoidable causes of childhood blindness by the year 2020. Their main aim is to eliminate the avoidable causes. Okay, those things which we can eliminate, we have to eliminate them. Okay, if we will treat the diseases at the time, then it will be cured. Okay, strategies. Now, what are the strategies? Strengthening primary eye care programs with primary health care to eliminate preventable causes. Okay, primary eye care programs should be done, primary health care programs should be done, so that we will eliminate the preventable causes, because we can prevent them and we have to eliminate them. Developing therapeutic and the surgical support services to deal effectively with the curable eye problem. Those eye problems which are curable, we have to uh, support surgically as well as through the medications also. Establishing optical and low vision aids. Optical aids means we have to provide the glasses to the needable person, as well as the low vision aids. Those persons who have the low vision, we have to provide the low vision aids to them. Now, what are the activities? What are the activities done to them? Elimination of the preventable blindness by measles immunization. Okay, so the immunity of the patients um, under the measles immunization have to provide medications regarding the measles. Vitamin A supplementation should be given to avoid the night blindness. Monitoring use of oxygen is the premature newborn. If the newborn is premature, then proper monitoring use of oxygen should be there. Okay, next one, avoidance of harmful traditional practices. Sometimes the traditional method should be used to treat some things or some diseases in case of children, so it should be avoided, because sometimes it can cause the blindness to the eyes. Promotion of school screening programs for the diagnosis and management of common conditions like the refractive error as well as the trachoma. Okay, school time screening programs should be done by the ophthalmologist, by the optometrist, and by the trust, so that at the time of school, screening programs should be done and the screening of the children should be done, so that avoidable blindness should be treated. For example, for the common eye conditions like the refractive error, will provide the spectacles to the myopic, hyperopic as well as astigmatic patients, as well as for the trachoma for the different eye kind conditions. This was the end. Thanks for your patience listening.